Hello, everybody. I'll go ahead and start this off with some housekeeping stuff like you haven't heard this once before. I'm Sidna Trimble. I'm an April board member. I'm the treasurer and the facilitator for today. Thank you for joining us for this workshop. You're here to hear about emergency preparation, innovative and inclusive strategies. I want to mention a few housekeeping items before we get started today. First, when you scroll over the screen, a menu bar pops up. Depending on what device you are on, you can find that menu bar at the top or the bottom of your screen. That is where you'll find the closed captioning for today's session. You can view the captioning by selecting the CC tab on the menu bar. For sign language interpreting, you can find the interpreter on the screen. If you would like to change the size of the screen, if slides are shown, you can select the line in the middle to make the slides larger or smaller. If you have technical issues, please use the chat feature. You can find the word bubble in the same menu bar. If you would like to turn the chat feature off, if you're using a screen reader, you can do that by pressing Alt and H. Or please use the info and help section on the conference website for more help. For Q&A times, please use the Q&A box that is on the menu bar. And please only submit your questions there as they will get lost in the chat. To ask questions or make a comment, you can also select the hand option on the menu bar that allows us to know if you have a question. For those of you on the phone today or using keystrokes, we ask that you press the *9 or *9 or the Alt Y on your keypad to raise your hand. We will then let you know that you can unmute, and you can select the unmute option or Alt A if using keystrokes. And remember, if you join in the conversation, please keep all background noise down as much as possible so we can hear you clearly. And with all of that said, I will turn it over to our speakers. Thank you.
This is Herman, and thank you so much, Sidna, and everyone for joining. My name is Herman Parodi. I am a board member as well with April and the co-executive director of the Partnership for Inclusive Disaster Strategies. I use he, el pronouns. I am a brown-skinned Puerto Rican man sitting in my wheelchair. And along us today is Beth. Care to introduce yourself?
I am Beth Meyer. I use she, her pronouns. I am the executive director of the Florida Independent Living Council. I am a older female with long gray hair, who with glasses, and a very busy bookshelf behind me with all kinds of things on it. So I apologize for that.
I am joining from Philadelphia, and where in Florida, Beth, are you?
I'm in Tallahassee, northern Florida.
Thank you, Beth. And as the conversation goes on in the chat, if folks could put what parts of the country you're in, and maybe as the conversation continues, we may touch on specific topics, but the innovative and inclusive strategies that we'll go over will begin seeing the very busy hurricane and wildfire season of 2017. Beth will begin by explaining the activities that the Statewide Independent Living Center led with the collaboration of all the CILs throughout Florida. And as that was happening, one ought to begin contemplating that in disasters, people with disabilities, Centers for Independent Living, and our supporting organizations can be first responders. We're not search and rescue, right? But immediately after, there are many essential services. And you will hear about essential services. At the beginning of COVID, many CILs had to fight a little bit to be recognized as essential services, to be providing services. And we'll touch more on that. But during this time, know that, with the partnership in 2017 by the leadership of Marcy Roth, who used to be the FEMA, the Federal Emergency Management Agency, Office of Disability Integration and Coordination's director for 8 years during the Obama administration. He created a great collaboration between FEMA and the disability community throughout those years. And in the last 4 years, it had been a little bit absent from federal side. And I will share that FEMA does have now a new, FEMA ODIC does have now a new director, Sherman Gillums, who he just came in about a month ago, and his first deployment right now is to Puerto Rico. He is there today, he landed. He will meet with Mavi Betsaida Ramos, the Center for Independent Living Director in Puerto Rico, and focus on the needs of our community and collaborate with us. So there are good practices coming ahead. But Beth, why don't you start sharing what you did once you saw Harvey coming and how you began organizing?
Well, I have, thanks, Ramon, first of all. I have been either working at a Center for Independent Living and or ADA coordinator for a county for many years, 20 plus years, like 25 years before coming to the council. So what I brought in is the work that kind of happens at a county. We also closed a Department of Justice settlement agreement. So I understood what the feds were expecting us to do really on for, this program of disaster response and making sure that it was accessible to all of our citizens in each state. So it has been a kind of like an evolution of understanding the process and then really trying to dig into solutions. And so we have been, one of the things that we did initially, we're just reaching out to Marcy and Herman and Shaylin through the Partnership of Inclusive Disaster Strategies. We had to really have someone that was available to us almost all year to have frank discussions on systemic barriers and why they are in place and how we can better address them and then understanding the roles. And so I think everybody sees a little bit more involvement with ACL and discussion with disaster response for our SILs. And I think it's because there's a recognition of the work that's being done and understanding that fifth core service a little bit more, because it really is highlighted when there's some type of response for a state. So when I came in over to the FILC, the State Independent Living Council, I started in the summer of 2018, and about 3 months later, Hurricane Michael came through. It was a Cat 5. We went to bed, it was a Cat 3, and we woke up and it was a Cat 5. It was not a good situation. And so we began hosting daily calls because we didn't even know whether or not our center in Panama City was even there, or the people were alive, because there were people that had perished, and it was a direct hit. So we scrambled to understand communications and what do we do and how do we do it. And I had just literally started this job, so I had a lot of opinions, but what was in place and what we did were really more of a defensive type of reaction to everything. We would get calls and people posting stuff on our Facebook page, and I immediately tapped into Marcy and Herman and Shaylin as, could you help me out here? Because there was nothing really, there was no FAQs that I could just pull up and reference. And And then I knew what the sills did because I worked at a sill. But in this type of disaster, it's just, it was not, we did a great job, but there was a lot of catching up. So after Michael, we had, in March, we had a roundtable discussion for the sills, and every one of the sills participated. And we had a discussion on, like, what is real? What do we do before a storm? Like, just let's be real about this. And what do we do during a storm? And what do we do after the storm? Three things. This is where, when you have a discussion with your sills, you bring in, the partnership, and because they're able to be a third party and help guide the conversation to where you need to go. So what we did was had everybody at the table. We talked about all the things that we did in preparedness and throughout the storm. And then we said, okay, let's go back and let's say, what should we have done? And then let's just be honest and say, this is probably what we should have done. And let's do that for the preparedness, and let's do that during, and then let's do, because we're not first responders in the sense of what a first responder is to an EOC. And then what do we do afterwards? And so we looked at that, and we created pretty much our goal for our state plan, which is very specific to the work we do, and captured all of the work that we discussed. And that that goal 4 talks about collecting data on, do you have an MOU? Because that was something we talked about. Are you reaching out to your counties? These are all the sills. And do you have a relationship with Red Cross? Do you have a point of contact with Red Cross? And we put these in our spill, and we've been collecting this data, and then it allows us to talk to the sills that maybe are doing less and try to understand why, and get them to where we need them to be as part of an IL network in the state. So 15 sills, 4 solid, other satellite offices, and covering 67 counties in the state, all both Part B and Part C sills. So we really had to kind of dig into roles and being strategic where DME was, durable medical equipment, understanding how we can provide trainings and assistance during blue skies, getting MOUs with the counties for possibly interpreter services, or at least connecting them with that, understanding who that ADA coordinator is and if you have an active ADA coordinator, really partnering with them so they understand the value. There's a lot of work to do all year to prepare for a storm. Provide examples of, we came up with examples of possible additional training from FEMA that we needed. We would consider, the SILs could consider to have a staff member take and participate in, and identifying a staff member that would play an important role during a disaster, having the understanding that they're calling the consumers before a storm, and then making sure that another SIL could assist you with following up after the storm if your SIL was impacted. Like, do you have a partner? Do you have a SIL that's in close proximity that would be able to call your consumers for you because you might sustain some serious damage. We had 4 sills that were directly impacted from this last storm. One of the sills, their building is gone, gutted. And that sill is in Northeast Florida. So we have the daunting task of understanding when a hurricane comes in, it pretty much covers the whole state. So everybody is somewhat impacted. Everybody is always somewhat impacted. But then there's some sills that are more significantly impacted. So we have 4 buildings that were, sustained some level of damage. Some not so much, it's not bad at all. Our Fort Myers sill is up and operating with limited Wi-Fi, but it was not damaged anywhere near as much as the Sarasota and the Daytona sill. And so, it's being able to send teams in to help the sill that's hit the hardest, call the consumers. You might have to share your consumers. So, at least we know where they are and to be able to assist. A storm, a hurricane and fires are the same, I know, but it requires cooperation. It commands that you cooperate and you work together. So we have these daily calls that were started with Hurricane Michael. Herman and Shaylin are on these calls. Marcy's on the calls whenever she can. FEMA's on the calls. Red Cross is on the calls. And we handle problems that are real time. And we provide solutions to the sills then. So Herman, do you want to add to that?
This is Hermano. Thank you for that overarching framework, Beth. Do want to thank folks for sharing where you're joining from. We have folks from a few statewide independent living councils from Georgia, New York, and Idaho. And we have folks joining us from sales and colleagues from North Carolina, Michigan, and Eastern Kentucky, from Hazard, from Utah, from Montana, and from North Florida. As Beth was explaining, delineating what you do in steady state and coinciding that with what will your consumers need in a disaster. What type of disaster? I mean, a disturbance to essential daily services, access to medication, access to transportation, work, education, personal assistance, your daily activities. And this could be from a storm, from a flood, from an earthquake, from a fire and wildfire, from a blizzard. Certainly think also about power outages and extreme heat, as it will go on throughout the country year over year. Extreme heat puts a strain on the electric grids. Power outages will be something that we need to prepare for. And localized fires. We don't need to, disasters in the term that the local county and the state cannot respond to the needs and causing a federal declared disaster. But we here in UDO perhaps with building and house fires. Another you're dealing with transitioning and intervention. That in itself for that person is a disaster. And that micro wraparound service that you're working to get, the person out of the institution, the needs to get that housing and those first payments and those first utensils to get them going, but across the board. And to accomplish that, you need, as Beth delineated, a great example is having in your spills at the statewide independent living, level, emergency preparedness response. As you did through COVID, many of you and many Centers for Independent Living did vaccine sites and other essential services, delivering food and other essential items. Those relationships that you have developed with public health, don't drop them, continue them. Beth, why don't you share some of the successes through COVID, perhaps early in 2020 when we did not have a vaccine still. Our community were at the margins of response in the initial phases of quarantine, how many people were without personal assistance, food, water deliveries. And let's not forget and remember during the summer that the killing of George Floyd. It's an awful, and we need to stop such crimes from police force and discrimination to Black communities. But the civic disturbances that came following throughout the country. I live in Philadelphia, and many of you. And how would we get the personal assistance and essential needs during those moments to our consumers? Beth?
Thanks, Ramon. I'm going to start what we did with COVID with just a quick, I'm just going to read you our goal 4. I'm not reading you the activities, don't worry, because it's it's the spell and we know how those activities go. But goal 4, this is what we have: disaster preparedness, response, recovery, resulting in systemic change. People with disabilities will have equal access to the community resources as a result of a disaster. And then we put natural, such as a hurricane or a pandemic, human-made, such as terrorism, civil unrest, or mass shooting. We put that in there. Or technological, such as a chemical release or power outages or mass cyber security breach. We put that in before the COVID response because we wanted to make sure that we were at the table if there was something that happened. We had already had a shooting down at the Pulp Club that was 100%.
Pulse, yes.
Oh, yeah, thanks. I couldn't remember it. Thanks. But it's so that we had already happened, and we wanted to make sure that we were just being like just exactly what Herman said, kind of, there. And what does a disaster look like? It doesn't look like necessarily a hurricane for a lot of people. So what we did was COVID provided us a great opportunity in our mind for a stalled storm. And that's what we would call it, a stalled storm. It's very hard to come up with really great solutions during a disaster. But we were able to really dig in to opportunities during COVID. So there was systemic barriers such as transportation needed 48 hours to set up rides, yet the COVID shots were being announced at some of the, pharmacies, and you got about 24-hour notice, and that was coming out of the Department of Health. Well, how can we address that? And this was leaving us out of we were removed from the table by that systemic barrier. So when we brought it forward to them and understood, and we have a seat in the EOC. I don't sit in the EOC, I'm in the EOC because we provide answers to their most complicated services that they're trying to provide and who they're trying to assist. Our SILs can do that for them. And so we're in the EOC during this time. So we went ahead and had some SILs come up initially at the beginning and work in the EOC because I mean, we cannot do that. And they worked in there and were part of the team and got to understand what was happening so that we were able to work with our local transportation, paratransit, and get a food delivery to all to our consumers. So the transportation that wasn't running initially because everyone was staying at home was able to still do work by delivering with their centers food to people that we said stay home. We're talking about sheltering in place is what we're talking about. So that was very important. And so there was over 23,000 pounds of food delivered to SILs in our state to be delivered to their homes. Durable medical equipment went out. We provided virtual benefits for the SNAP EBT cards. We started setting up virtual opportunities to work with our consumers and working through that and still providing those critical things that happen that they needed assistance with that we could help. And our SILs did all of that. They held virtual gatherings because isolation was like a big deal and it was impacting our community. And so we started seeing virtual gatherings rolling out. And then really working with the local transportation to make sure that some of the healthcare services and those doctor's appointments weren't being missed, that we were able to work with them on that. And then what we saw is really receiving the vaccine was a barrier. It was a problem. So we asked, can we open up our SILs as vaccine sites? And we had been a very good partner during Michael. And we had been a very good partner at the first part of COVID. And then we said, we would like to open our SILs up and we asked whichever SIL wanted to participated. Well, they all wanted to. They might have offered it not in the SIL, they might have offered it in like a local church parking lot, and it was a drive-through vaccine that they also could get food, they could also get other resources, literally, provided for them and given to them in their car. So 13 of the SILs actually ran, they were operating as COVID vaccine sites. They had multiple days that they would do this. And they would have the Department of Health was in charge. We had a vendor, CD McGuire, that worked down from Miami that sent out their nurses, and they were the ones working under contract with the Department of Health. So our SILs were just making sure that the facility was accessible. Most of them were in the SIL, and providing some of those wraparound services. There was like about 5,000 people that received vaccines. We also vaccinated PCAs that came, with, and that was, one of those punch lists where initially the people that were able to receive the shots, PCAs weren't initially on that list as the priority, but what we found is when they came out, the vaccines, they really needed to use the vaccines, or they lost the vaccines. So we just started making sure that we had our PCAs there, and we were providing those vaccines to those people also that were that are a critical part to independent living and personal care assistance. And so it became another good partnership. We held, I think we held one of the first, we sent out surveys on vaccine hesitation, trying to understand why not all of the consumers wanted to get vaccinated. And then we created Med Talk. That was a South Florida SIL, created Med Talk, which is inviting doctors to come on and talk to the community directly to answer questions. And we understood why some of the consumers were choosing not to. And it was a very, very valid and important reason to our Centers for Independent Living. And we had to communicate that to the Department of Health through the process. We also provided, accessible training at the FEMA vaccine sites. Our SILs were able to go there and assist with that. But we just kind of had to get ourselves to the table and stay there. It was, I would say, very successful partnership for our state.
This is Herman. Thank you, Beth. I'm sure that resonated with many on the call. We also have colleagues joining from Wyoming, New Mexico, the Wisconsin Silk, from Northwest Iowa, the Youth Lead from North Carolina, Idaho, and the North Carolina Silk, Eva Reynolds shares that they have an emergency preparedness included in their North Carolina spill. And Alyssa did share wonderful work, Beth, and Alyssa, in the middle of the chat, if you scroll up, you'll find the link for Mavi's SIL in Puerto Rico as well. In keeping up with all these activities, it's recognizing essentially, and you all know this, what do our communities, or what does our consumers need to remain independent? And as disasters, as disturbances to essential services continue on the rise, increasing the capacity of Centers for Independent Living, as Beth has shared, is something we at the partnership do every day. We provide trainings to Centers for Independent Living, emergency management, public health agencies throughout the country. And since 2017, we did deploy a team to Puerto Rico following Hurricane Maria, and have been collaborating. We supported there with the Center for Independent Living daily, connected them with FEMA, and as Beth has done in Florida, in Puerto Rico doesn't have a silk. They have two centers, and they collaborate strongly. The one in the capital, San Juan, Mavi, since Maria, they have emerged like heavily themselves, as Beth has, into their emergency management and public health at a state level, involving local collaboration throughout your counties in looking for what are the needs of your consumers. Not only the disability-related needs, but information, thus making things accessible as you would in sign language and in different languages, not only perhaps Spanish, but looking at the census, looking at your county, and looking at what are the most used languages in your county, and maybe even including the question for your consumers. And specifically in disasters, as we always ask, and it's mandatory, but with the ADA, right? But having emergency services have emergency briefings on TV and radio, but especially on TV, having ASL along, because it starts at the beginning. It starts at being informed. Just to a couple more examples from Mavi's success. In 2020, there was in January, just ahead of COVID coming to our side of the world, there was a massive earthquake in Southwest Puerto Rico, and through Mavi's collaboration with emergency management, the rescue to people with disabilities was much more focused. Something that did not happen in Maria, and its safe lives. And 2 weeks just ahead of Ian impacting Florida, Hurricane Fiona impacted Puerto Rico. Mavi is currently responding, as I mentioned at the beginning, meeting over the next couple of days with Sherman from ODIC, FEMA, and finding the needs of their consumers and looking for ways to support them at the moment of the disaster, the need, and preparing them through your staff, consumers, full involved community, looking for other organizations and the essential government entities that you need to develop relationships with. We've gone through a lot, and we want to, in a moment, go through to some of the examples that the Centers for Independent Living are currently responding. I mean, there are sales staff in the streets throughout Florida doing activities that we want you to hear, but does anybody have questions from all the ideas and examples that have been presented? You can submit your questions in the Q&A box, or you can raise the hand feature. I think on keyboard is hold Alt and press Y to raise your hand. Karen on the chat shares, our SIL offers services such as life-sustaining food, water, and supplies during COVID in Eastern Kentucky in our service area, as well as assistance to connect consumers to healthcare and COVID vaccines. Now we are still assisting our consumers with services since Eastern Kentucky flooding. Thank you for sharing, Karen. We from the partnerships have been in touch with Brenda and Catherine and working to connect them with FEMA's Regional Disability Integration Specialist. All of these terms and we will provide we'll put our context. If you have more interested in learning more of these terminologies and activities, don't hesitate to reach out to send you more information. But connecting with your artists, and there's one for every region throughout the country. In steady state now, if you're not going through the disaster, introducing yourselves, or we can introduce you to them, it's essential developing the relationship. They can introduce you if at your local or state level, you're not having that door easily as open. But Beth, why don't you, I mean, as you were sharing ahead of the of Ian, you had already started daily meetings throughout, including with Red Cross and FEMA and the Centers for Independent Living, and we were joining. How did you, how did your Centers for Independent Living across Florida prepare? Did they do contacts to consumers ahead of time? And those, you had about 4 or 5 days ahead of the storm to know it was coming. And then the immediate response and the activities now 2 weeks still after.
Right. Okay. So one of the things that we did for our planning was every consumer that comes in is asked in their CSR packet, do you have a plan? If there was an emergency, do you plan to evacuate? Do you, what is your plan? Do you, and try to understand that. Do you want to be contacted if there, is a storm? Because a lot of the centers have gone to, a mass call out that can reach like 2,000 people quickly. That mass call out allows them to provide possibly next steps. We don't provide where to go. That's done by your county, and you have to let your county own that. That's their job, and they're required to do that. But as a SIL, we can ask our consumers, are you prepared? If are you interested in learning more about being prepared? So a lot of them have emergencies preparedness conference that brings people together and allows consumers to see what a shelter looks like, because they're not super comfy, and really what you can bring. That activity of providing a in nice weather, an example of what a shelter looks like, allows people to understand what their responsibility is. I mean, everyone has their own responsibility, and it is a choice to evacuate. And unless there's, a mandatory evac area, but people could still, hunker down and not leave. But there's not going to be anyone to come get you once the storm arrives. The hard part about this particular storm was that everybody pretty much thought it was going to hit Tampa, and because that's where it was going. But it started moving left, right, and then took a hard right. And that's why a lot of people didn't evacuate. And I'm going to get to Herman's question, but I want people to think about, because this happens in your state with your, whatever your disaster is, different. It happens differently, but it happens. People that live there think of disasters differently and manage them differently, whether it's a fire or whether it's a storm or tornado. And in Florida, I think we think of it a very linear when it comes to a storm. It could hit, we know what the difference is. You can be a mile, a half mile on one side of that wall and barely receive anything. It can rain in your front yard and not in your backyard. So what we know is that the community is gauging evacuation on that. Exactly where is it going to hit, because that's going to be where we need to pay attention. And everybody just thought it was going to be in Tampa. So when it took that hard right, there's a lot of people that chose not to evacuate. But what you can do as a center, and what is a really important thing to do before you get a storm, is understanding what do all of the centers, what other services do they provide? Identify all of those things before a storm. And this is something you can put in your state plan. Identify all of those services and capture them so you have a game plan. And then in addition to that is, we do call every day when a storm is coming or there's a disaster. We meet once a week in blue skies, but we meet once a week to make sure, just to do a check-in. It's not mandatory. We just open it up. It has been a very great platform for SIL executive directors to compare how they use their public health workforce dollars. How are they using some of their CARES Act dollars? It's just a IL call, and you can talk or you don't have to talk. But sometimes they share challenges that they're having, and it does create and foster the environment of team. So when a storm comes and we go to daily calls, we bring in the big people from the national people, because we want them to have, we want them to help us. ACL has been on every one of our calls since the storm hit, every single one. Ed Aaron has been on them from ACL, who's new to ACL, and he's phenomenal. And then Veronica is our new point at ACL for our state, and she's been on almost every one of the calls. So they understand what is happening. So has our DSE. We invite everybody. These are the people that we are going to count on. Like, what if we need an extension? They need to know that there's a SIL, that the building has been destroyed. And they also need to hear from that SIL what they're doing, and they're able to do that on this daily call. We try to provide real solutions. Today, one of our SILs asked for an extension for their PPR because of the fact there's no building and they've lost so much. But there are processes that you can put in place, whether it's, for us, we raise up everything up because of the water. For us, it's getting those computers on the desk and covering them in plastic, making sure that another SIL would be able to assist in calls, having important information that you need on a thumb drive. These are things that our SILs do to prepare for a storm. Making sure that there's a chain that they can call for their staff so that there's a game plan and a check-in with the staff. It would be different clearly for a fire if you were preparing, and it would be really different, even for a tornado. I don't know that you'd put everything on top of the desk. I think you'd probably put things under the desk, but it's for you to decide. No, there's no right or wrong, and you would be able to understand that. But then what did PHLC do to prepare? That's the State Independent Living Council. Well, we lose contact and we lose cell phone towers. You're not calling anyone in an impact zone. There's no cell phone towers left. They're down. And we still have towers down. We can bring towers in, but it takes time. So we have 5 communication boxes that I created from lessons that we learned in Hurricane Michael. We sent information, including all the SILs executive directors, their cell phone numbers. We actually have satellite phones that we can activate pretty quick. They all have new SIM cards in it, and we activate them. And that way, if there's a storm, and it's a policy that only allows it to be activated for 2 months. So the satellite phones have different ways of charging. So we have different batteries in there to support what is in the communication boxes. We do have some Ubi Duos in there, and everything has been laminated and covered in plastic because we sent stuff to the Hurricane Michael. Some of these SILs are operating under a tent, and everything got wet or blew away, and they were of no use. So we have these communication boxes that are out in different points. If a storm is coming to a specific area and maybe maybe Miami needs to have that communication box, then we'll have the closest communication box sent to Miami so that they would have it. So they're kind of expensive, and but we track the inventory. But we activated the satellite phone for Fort Myers, and we were able to talk to the people that were in that area when there wasn't really good cell phone coverage, and in areas where there's no coverage at all. So that was what we did and then we host those calls, and then we put information in those emails to everyone every morning. So like 7 o'clock in the morning, I send out an email. It has all the updated information. Gas stations that are open, that are provided to us by the state, where cell phone towers portable ones are being deployed. And for the very first time, we actually were told that if we could not find one of our consumers, or we feared for one of those consumers, we had a direct access to put in a mission for the search and rescue team to go find our consumer. And we've never had that, but that's because we're in the EOC. And again, I'm not sitting at table in the EOC every day, but I could go into the EOC at different times in the day. And then I connect with the people that we need to connect. And they did not want a Katrina. And this was a Katrina type of event. This was a water event. This was, so that was the problem. All right, come on.
Thank you, Beth. And we did receive feedback that this is such valuable information, and it would have been helpful if a PowerPoint or accompanying material would have accompanied this. We do apologize that the preparedness and it all didn't allow us for the time, but we will do what we can to put additional material if possible, or send it to attendees. And don't hesitate to reach out directly to us for questions, and we'd be happy to disseminate all that we have. Beth, a question came a little bit ago from Sarah Michaud. Apologize if I mispronounced. You mentioned that you were in the emergency management office. That's something we are exploring in New Mexico after the Hermit's Peak Calf Canyon wildfire, fire, the largest in New Mexico's history. What was the process of getting you established at the Emergency Management Office, or you mentioned EOC, Emergency Operations Center? How did you go about this? It will be helpful to learn and hear more.
We did that through by inviting our partners, by inviting the people that were in the EOC, like the mass care people, to our daily calls to help us problem solve. So they were getting inundated with DME requests and inundated with challenges that they had not ever thought of, like communication and interpreters and just the entire what the SILs do, the whole wraparound services. And so you have to be willing to invite them in, and you have to be willing to show that you're a partner. When everyone is invited, not every SIL participates on our daily calls. I don't care whether they participate. We proceed, and then you become relevant. So this is work. I am definitely in a different, there's not a script for this. So be relevant, and the SILs, bring them to the table. I'm telling you, for the first time in our history, we're able to, Salvation Army gets money and participates, and they're reimbursed and get part of some of the funds that are created here in Volunteer Florida. But then other places there, the governor creates funds to go out to the community, and it's always Salvation Army, some of the feeding programs, and then we're asking questions. Why not us? Why not ourselves? Well, this is where having a national partner is a very big deal, because for right now, and I do apologize, I have things on slides, but because we're in the middle of a hurricane, I couldn't finish it. So, but really, this is where you have someone like Herman or Shaylin or Marcy say, have you thought about this? And sometimes I ignore them because my brain is full and I just can't. But I've learned to listen. And so they kind of tee it up a little bit for you, and you're able to then go and say, yeah, why aren't we getting this? Why aren't we, our SILs are out there driving all over, and they're not able to be reimbursed in the same capacity as some of the other state agencies or providers. And I filled out an MOU, and and told our story. And we were accepted. So I don't know what that means for us yet, but I hope it means that the impacted sills can be reimbursed for what they're doing, because it's above and beyond. Yeah, it is transition, but are we paid for bringing gasoline into a center that has lost everything, so that we can generate, so we can use the generators, so we can charge durable medical equipment, so we can prevent institutionalization? That's really not what we're supposed to be doing, is delivering gasoline. However, if some of our sills do that, and when that happened in Hurricane Michael, bring it, because gas is gone. You're not getting anything. So then we have to decide if the sills are navigating that, then we need to have some type of documentation that says if there's a curfew, we're able to check on our consumers. We got that. We're actually getting gas cards this week for the sills that need to go, they're traveling 2.5 hours into very rural areas. And we've never been able to get that. But you have to pay. In order to be at the table, you got to work every disaster. But what's going to happen is you're going to benefit if you can, and I'm trying to document with Herman and Shaylin's help and Marcy's help, document what we do in order so it's easier for someone else next time around. And that's what we're doing. Because there is a process. But you have to be able to, I really don't feel like doing daily calls right now. I'm tired. But if I don't do it, then guess what? It's, something else happens. So, and it's great to get support from other states, but sometimes the support comes in and now they have marginalized the work of the sills. And that's when you have to say, hey, we provide that service. And we're open and we're doing that service. We don't need you to pay another entity to come in from another state to do our job. These are our people, our consumers. And so you have to be able to manage the gate, so to speak, so that you're able to say, no, we appreciate your donation. If you want to send durable medical equipment to the sills, go for it. But you're not going to be reimbursed at our expense when we're not getting any money and we're delivering this DME. So I say we, and I mean our sills, just for clarity. I'm not doing any programmatic type of activity. But it is a communication, and when the sills see that you're got their backs, and you're bringing them opportunity and you're making their job easier. Like they all got impacted sills, got $2,000 from Walmart. That came from the EOC. And to do the work that they need to do. That's a win. Getting any funding for them, that's a win. Getting their, that means we have to collect messages. We have to collect stories. That's the hard part. And that's where I screwed up totally in Hurricane Michael. And Marcy kept saying, Herman and Shaylin, hey, are you documenting? Yeah, I'm doing the very best I can. But really, it's not funny. You got to document it. Or you just did all that work and nobody even knows or cares. And the people that are getting all the credit are those giant agencies that get all the money. Meanwhile, boots on the ground, our sills are marginalized. So your job is to make sure your sills are not marginalized in your state by elevating the work that they do. But you have to know what they do before you do that. And I don't say they'll do anything. We talk every day about what we can do. And so you have to provide that support and respect in communications. And sometimes you have to provide workarounds with other sills, but it doesn't matter. We do that. So everyone has their catchment area. Everyone's very protective of their counties. However, during a storm, we work like a team, and it's kind of just how it has to be. So hopefully I'll have something out of this that will be useful for people.
Thank you, Beth, and seen some hearts and thanks on the chat. For folks, Beth has mentioned MOU, the Memorandum of Understanding. This is an approach you will find Alyssa put in the chat, a link titled Emergency Relocation Toolkit, developed by Silver. Silver's a committee, the partnership, and April, a number of national and local sales and disability organizations are part of that supports deinstitutionalization during disasters primarily. And you will find that Beth has talked about, reimbursement and you, as sales, how are you going to technically pay for the staff, the time, the equipment, the gas, extra resources for your consumers when no one else is. And FEMA, through even though it has emergency support functions, emergency support measures, and in these measures, you have entities like Goodwill, sheltered workshops that qualify, adult day care centers sent to directly provide essential services as we've been discussing. In 2020, during COVID, and recognizing all the work that sales were doing across the country, in response to supply essential services, not only your core activities but going over and beyond, we met with FEMA, with the National Council on Disability, through the summer of 2020, in developing what came out as a FEMA addendum for personal assistance services. And you will find that in the toolkit. From there, it was recognized that Centers for Independent Living could work with their state emergency management agency and their county emergency management agency. You will find a memorandum of understanding of how to, ahead of time now, collaborate with them. I will put an additional link on the chat. We've mentioned RDSS, or Regional Disability Integration Specialists. They are one for every region throughout the country. You'll find their emails on the link on the chat. If you don't hear back from them within a week or two, feel free to contact us and we can nudge or reach out. Our colleague from New Mexico truly encourage you to reach out to your artists to help connect with your local emergency management and everyone on the call. With this MOU, we have a success story, as I mentioned, from FEMA with PAS, a Center for Independent Living throughout 2021, and still now, as there is a nationwide disaster declaration for COVID, a Center for Independent Living in North Central Pennsylvania, Roads to Freedom, has been able to use this mechanism and the MOUs you will find in the toolkit, successfully assisting in relocating people from nursing homes, numerous people that their lives were in jeopardy due to high COVID rates, to a hotel, working for the reimbursement to cover that hotel, the transportation. You hear wraparound service, so food, water, other essential services that in a hotel room you will not find, PCS, personal assistance services. And even if your Center for Independent Living directly doesn't take in these activities now, perhaps you don't serve personal assistance services as an agency or as fiscal management services. If you have, you can still contract that out, and you will be the one applying through FEMA. So there are and which is how Rose to Freedom did it. There are ways to go about this, and feel free to explore the toolkit. It will give you the tools you need to show your county and state emergency management, this is how we want to collaborate. As Beth has explained, it is very helpful having it in your spill, emergency preparedness, response, recovery, involvement, and understanding what are the services that you do provide now, how can they coincide of essential services in the immediacy preparing for and in response to a disaster, and that in the recovery phases, you can be involved so the recovery can be accessible, can be inclusive. We have infrastructure problems throughout the country. Disasters open that opportunity. Hundreds of millions of dollars come immediately after. And oftentimes reconstruction does not happen accessible, but when you are involved, it can. Beth, do you want to spend some time? You haven't touched too much on, your Centers for Independent Living throughout Florida are helping people right now. Mm-hmm. It's incredible work. You want to share some of the successes and just maybe not successes, but the work happening, which is over and beyond, can give folks ideas, and it will be part of after action reports that we will surely help dissemination through April. Beth?
Yes, I absolutely will. But I'm going to say one thing is I am going to have a constant contact for next, that's a checkbox for me. Because, and for the state, the stories that are coming out are pretty significant. We have our SIL, and we've served hot meals for the first time ever. We usually get those boxed things that are they don't taste very good, but sometimes that's all you get, and that's okay. But we're able, there's a rescue barbecue like group that goes around. We have served thousands of our consumers, and some of them old, some of them new, hot meals, not just boxes to go home, but hot meals while they're there, checking on them. And thousands of people have received hot meals at our centers. Your centers turned into hubs. So if your center's destroyed and you could put a tent up, you put a tent up, and everyone comes because they don't know what else to do. And this is what happened in Michael, and this is what happened here. Over 100 gallons of gasoline was brought into the impact area because there's no gas. And then how do you charge? And then we set up charging centers. So this is something we're going to look into for the future. Charging centers that could be possibly solar charging centers that could be used at our SILs for durable medical equipment, which would allow people not to have to go into a shelter just because they're trying to charge their equipment. That's something that we're talking about. In addition to that, thousands of pieces of durable medical equipment. We've got hundreds and hundreds and hundreds all over the state of durable medical equipment go in. One thing when you go into an impacted area, you don't go into an impacted area without food, water, and DME. It's just, you can't. And batteries, things that you need. We reached out to New Motion to get additional DME that's specific for people. But really, what some of the stories have been, that people that need to get to a shelter or at a shelter and need additional support, that happens. Moms, dads, children, families, and keeping the family together at all costs. Oh my goodness. That's something that we also learned. literally, some of our shelters are in schools. And so those are always the first to close. And then those people go to the next, shelter, which is a general pop shelter. And then how do we keep everyone together? Making sure families that are in the hospital are actually have some type of communications with people that are, in a shelter or hotel rooms are set up, and we try to make sure we secure those. And that was something that we also do through the partnership. So, I mean, we cannot, I'm almost at really, Herman, just a loss for how many independent things that we've done. The SILs have brought in staff. They go into, we call them the impacted area. It's not an area you really can stay. There's no hotels for, like, we figured out 75 miles away from where the storm hit. But then you have to deal with the cities and towns that aren't impacted, still hosting national football games. And that impacts your hotel space. And then how do we have that conversation? Well, we just have it. But there are a lot of challenges that go with that. So, we first take care of the teams. We have staff that have lost their home in this storm. And I'm going to tell you, I wish we could create something where there was almost trauma care for ourselves, because sometimes bringing in volunteers doesn't work out so well because they don't like what they see. And people think they want to come in and help. And it ends up being a problem because they're really not helpful because they want to go home. It's too much. It's a lot of trauma. When you go into a shelter that has, 600 people in it, it doesn't feel super great, but it's a roof and there's food and there's beds and sometimes there's no beds. Sometimes it's just sleeping bags. So, it's really important that you take whatever it means to you, whatever it means to your state. It doesn't have to be this, but whatever it means, really, you could take it to your SILs and reflect on what is, or take it to your state, because your state and your counties need to work together. Your state and your SILs, your SILC, and your SILs, they need to work together because there's different solutions. And there are some things that I can do for a team that are working 14-hour days, right? And so we have to kind of pull that together. Calling our consumers is always number one priority right after a storm. And then, and that is done almost immediately, and then getting out into the area. But at the state level, you can make sure they have access to get out, because a lot of times that, especially I would imagine in a fire, you couldn't traverse wherever you wanted to go. You would have to have permission. There's just personal story after personal story, and picture after picture, but then it's also devastation and what happens to our people that have lost everything. So goal is to keep everybody together, families together, so they don't get separated. Stop institutionalization if at all possible, and help with that transition. And it is not easy. So you have to kind of be prepared for that.
This is Herman. Oh, thank you, Beth. So much good knowledge there. And Alyssa did share in the chat that the reminder that the download for this recording will be available later on in the conference website. So many activities, and it needs to be taken into a multi-pronged approach. Disaster
You went on mute, Herman.
Thank you, Alyssa. This is so many activities that you have heard. Thank you, Beth. I think I made the reminder that Alyssa did say that this recording will be on the conference website. And there needs to be a multi-pronged approach from top, bottom up, to develop a culture of preparedness and be ready to respond. I put a link on the chat to information about 2 pieces of federal legislation. One, the Real Emergency Access for Aging and Disability Inclusion, otherwise READY Act, Ready for Disasters Act, and the Disaster Relief Medicaid Act, DRMA. Beth was closing up with CIL's need support. She's been talking a lot about the work that she's able to do, and we compensate and collaborate from the Partnership for Inclusive Disaster Strategies. We are the only national disability-led nonprofit fully focused on people with disabilities before, during, and after disasters. And all of our staff and our previously have worked in Centers for Independent Living. Ready for Disasters Act is a bicameral, bipartisan piece of legislation. Already, if it doesn't move this year, already in works with Senator Casey, who introduced it in the Senate, and works who will reintroduce it in the House as it was introduced by Congressman Langevin out of Rhode Island, who will not be rerunning. READY would create disability and disaster training centers and research centers throughout the country, building on the 51% of its staff, board, and services be people with disabilities, with a national project of national significance to support the regional training and technical assistance centers. It would also look back at evaluating mismanagement of funds from disasters with a lens of discrimination on people with disabilities and older adults. In disasters, many people also have to evacuate across state lines for an array of reasons. Many of our consumers are people on Medicaid if they receive HCBS, Home and Community-Based Services. Healthcare, Medicaid, HCBS, and CHIP do not cross over state lines. This is awful and difficult in steady state, and it's dangerous in disasters. DRMA would make Medicaid and all Medicaid services follow the person in a disaster across state lines. It would also increase the FMAP match to the impacted states to 2 years at 100%, and to the states receiving new disabled disaster survivors, those states would be fully supported by HHS and federally matched Medicaid at 100% with preemptive and seamless eligibility. It would also create a pilot program for 5 states to have a personal assistance response corps, have personal assistants ready to have training on disasters and be able to support impacted areas that people themselves are impacted, having outside of the area teams ready for personal assistance in the community, as the systems today are primarily focused on shelters and other institutions. There is a question on the chat, on the Q&A. My actual name is, this comes from Kay McKillen from North Carolina, which gets impacted with natural disasters like tropical storms, but it is usually not enough to have evacuations or shelters. I live independently, but I use in-home services to help me throughout the day. I usually rely on natural supports who live an hour and a half away from me when it is a natural disaster or emergency, but I'm not going to have those natural supports forever. All to ask, I am curious if any state have addressed this issue with what happens when there is an emergency, so people who use HCBS or home and community-based services can still receive their services in their homes. Beth, you have any initial ideas?
This, we are probably not the state to speak on this one, so. So this is, so you're exactly right. This is what happened in Katrina, people, and this is what happens. People evacuate and they go, and then you're left and all of your services have just evacuated. And so this is the big, huge number one challenge that we're all, we gotta think about this. We gotta come up with a game plan. We have to support things, legislation that speaks to this, because even though you haven't had that, it's North Carolina, I get it, South Carolina, there are areas that aren't, prone to, there's a lot of flooding in North and South Carolina, but that's great that you don't have to deal with that. However, there are solutions to this. We just, it's going to be a national type of discussion, because every county is going to operate things a little bit differently. And if we understand that every county is operating things differently, then we need to address that exact question, like point on all by itself, because it is all by itself. We are adding new spill actions in our state plan in order to address that better during a disaster and during the transition period. We have an interesting setup here, and so in Florida, but we are working to address that. But this is a challenge in some states. A disaster could be very much statewide, and again, it could be a tornado, it could be something else. Don't get stuck on what I'm speaking to, because we don't really have really tornadoes that often here, and we don't, fires, they can happen, but it doesn't raise to the same level. This is where you have to really look into your state plan. I'm going to tell you, the state plan is as valuable as you want it to be. And that state plan, we put a lot in there, not in two of our goal areas. And then we had some cleanup in the other two, but we are adding housing and PCA services and our health services in this new spill. We're not going to wait for whenever we're supposed to do the new spill, because we're going to go ahead and ask for it now. And the reason we're going to go ahead and move forward on this is because we have to have real solutions right now. You have to assess your own state, look at it, and then put the steps in that are going to allow you to communicate the failures and successes. It's really about taking yourself out of the equation and then putting yourself back into it, if that makes sense. Really looking at what would happen if this happened, what support what really happens here. You just have to kind of self-reflect on that. I hope that answers you asked the golden nugget of a question, so that I can't give you an answer to that's good enough.
It's difficult. This is Herman. It is. Kay adds in the chat, they know it's a bigger issue, but if there's a snowstorm, how would their personal care assistants get to her? Yeah, cannot get to her, then what? A couple of ideas would be, in addition, along home and community-based services and talking with your support coordinator, your case manager. These are, you want to have goals of discussing these plan A, B, and C. Perhaps having on your individualized service plan ready that if you need personal assistance services from alternative agencies that are not your direct daily provider, in case, just to have an open readiness, because if you ask for those things at the moment, it would take time. If you have those conversations ahead of time, it could be included in your ISPs, so you have multiple options to connect to in the moment of an emergency or a disaster. And having a direct number, a direct line, if not to your case manager, directly to your home and community-based service, so we have managed care agency, managed care organization, connecting with them directly and having a direct number with them. Last year, not due to COVID, I was hospitalized due to an emergency with a UTI, and they wanted to discharge me to a facility. I had the phone number to my managed care, started calling nonstop, and there's no reason why they couldn't discharge me home with the services at home, and which they did. So having a number to call that you can trust, and you've had these previous conversations, is critical. There's been so much information, but it really starts with having a conversation. Having conversations at the top level, at the state, the county, but also with your consumers. Introducing the concept of preparedness in peer support groups and learning what is it in their areas that they're most concerned, what are their gaps. We only have a few more minutes left, and it's been a packed conversation. Want to make sure that if anyone has any immediate lingering questions, please put them on the chat in the next minute. And if you do reach out to Beth and I, our information is in the conference website. Take with you, again, people with disabilities die 2 to 4 times more likely than people with disabilities during disasters, including being injured. This comes from the United Nations understandings from research following the Fukushima earthquake in 2011, and compensated with research from following Hurricane Katrina. This is here, and it's only going to get worse. But by doing things like Beth is doing, and we're here to support, involving yourselves in emergency management and developing a preparedness culture will help save lives. Beth, any closing words?
Just the fact that, be part of the solution. And that's what I would tell you, not part of the problem. Let's, really strategically place yourself as part of the solution, because your partners like, Herman and Chilen, they can help you work that, the problem actually out, because we got to get to a solution. And when those EOC people who have historically not open those doors up, when they see you as part of a team providing solutions that they don't even want to deal with, you are going to make a lot of headway. They are wired differently. And so it's kind of intense. So be able to come in with calm, got it, handle it. And because your SILs are already doing the work, they're already doing the work. So why don't you just let them do the work and you just tell the story. So that's all I have. And thank you, Herman and Chilen, for your ongoing support.
Thank you, Herman, and thank you, Beth. That was very important and useful information. I appreciate all of that. If all of you would please take the time to complete the evaluation when this webinar closes, that lets us know how we can continue to provide and keep providing training to you that you will find most helpful. Thank you for joining us, and we look forward to having you join us for our next session, which will begin at 3:30 Eastern Time. Thanks, everyone.
Thank you.